start. Welcome to our Facts, Safe Storage, and Abstract session. Thanks for joining us. We're so glad you're here. A few housekeeping reminders. This session is being recorded. Only the presenters and moderator will be visible. The participants are not visible. The chat is disabled, but we welcome your questions on the Q&A feature at the bottom. If you have a question for our presenters, please ask it by typing in the Q&A feature at the bottom menu at any time. And in fact, if you do it in real time as the abstracts are going through, it will be easiest for us to collect them and then process them for questions. We'll answer as many as we can after as time allows. A live transcript is available for the session. If you prefer to hide the captions, please click the up arrow next to the transcript button and select the hide transcript. And now we're excited to get started. We know that this format is a little bit difficult in that there's not as much fluidity as was just mentioning with the session in terms of timekeeping. So I unfortunately will ask our presenters to try to keep to the time that's allowed because in this virtual world, we don't have the ability to sort of flow over and adjust as we would in a different world, but we have such great stuff today. So please join me in welcoming our abstract presenters. We have, in the order they will be presenting, Rocco Pallin, MPH, is a research data analyst with the University of California at Davis and the director of the Education for the Bullet Points Project. Dr. Michael Gittelman is a professor of clinical pediatrics with the Cincinnati Children's Hospital Medical Center. Michael Soto is at the Department of Pediatrics Section of Adolescent and Medicine at the University of Colorado. Dr. Eric Sigel is a professor of pediatrics with the University of Colorado School of Medicine. Michaela Monsun is a research technician associate with the Psychiatry Child Services at the University of Michigan. Dr. Cynthia Ewell-Foster is a clinical associate professor with Michigan Medicine. Ferhana Begum, excuse me for that, is a MPH candidate and research assistant with the University of Michigan Institute for Social Research. And Christina Johnson is a clinical research coordinator with the University of Pennsylvania ARCH Arch Lab. Okay, we will begin screen sharing now with our presentation and get started. Lisa, if you could share our slides. And I will ask you all for some grace in managing our technology today. Things have been going great so far.
Okay, hi, I'm Rocco Pallin. I'm from the University of California, Davis. Can everyone hear me? Good to go?
Yeah, okay. Good to go.
So I'm going to move very quickly through some survey results about households with children that also have firearms in California. Can you advance the next slide? Thank you. So this study aims to characterize firearm ownership, storage practices, public perceptions of safety, and perceptions of risk reduction strategies in California households where children or teens live. We use data from the 2018 California Safety and Wellbeing Survey, which we refer to as CSAWS, a cross-sectional online survey of state representative sample of adults, about 2,500 participants. And the first wave of the survey asked questions on a variety of firearm ownership and practices, exposure to violence questions, and consequences of violence. Survey responses are weighted for representativeness, so the counts that I present here are unweighted and the percentages are weighted. Next slide. So like I said, I'm going to fly through this. It's a lot of information, but I'll note first for reference that the survey estimated overall that 14% of California adults own a gun and another 11% live in a household with a gun. 21% of adults, owner or not, who lived with children or teens lived in homes with guns. And about a third of gun owners, specifically, who lived in households with children and teens, reported storing all guns locked up and unloaded, which is the safest way to store a firearm. Just 4% stored any firearm in the least secure manner. That's that bar chart top right. We also examined primary reasons for gun ownership. More than 3/4 of gun owners in homes with children or teens reported owning primarily for protection against people. And so that may have implications for storage practices. When we examined responses on perceptions of safety among respondents in households with children or teens, majorities thought that a gun in the home makes them safer. Next slide. So nearly half of respondents in homes with children and without guns said they don't own, at least in part, for concern for children's safety. And then the bar charts at the bottom show that support was generally high for interventions to reduce children's risk of injury. These included support for parents asking if there's an unlocked gun where their children play, and health professionals talking with patients about gun safety. Next slide. And so finally, some implications. A third of gun owners who live in households with children are to store in the most secure manner. Those in homes where guns aren't stored most securely may be at higher risk of injury. And there is potential for further exploration of interventions for reducing the risk of injury among children and teens in homes who live in homes with guns. That's all.
Yeah, thank you. And Michael Gittelman up next, if you want to join with your video. There we go. Welcome, Michael. You're on mute, Michael.
Sorry about that. Can everyone hear me? Good. Hi, my name is Mike Gittelman, and I'm representing the Ohio AAP, and our program is called Stewart Safe, Partnership for the Safety of Ohio's Children Around Firearms. Next slide. In 2015, as an ER physician, I wanted to find a way that we could come up with consistent messaging to make kids safe around firearms. As a result, we said it's such a polarizing issue, we wanted to bring together a diverse group. So we brought together the NRA, police, military, physicians, parents, anti-gun activists, and many more. And we wanted to come up with a unified message, but we wanted to stay really focused on how do we prevent these injuries to children. So we wanted to look at unintentional firearms related to children and suicide of teens due to firearms. And we wanted to come up with a message that everyone could agree upon, and we wanted to do a media campaign throughout our state. Next slide. So the message we came up with was Stewart Safe. Everyone agreed to it. The NRA and gun activists said we can all rally around that message. So we just decided to come up with a two-armed campaign. One was to look at unintentional injuries to children less than 5 years of age. Through the AAP, we developed a quality improvement program. Since we've done a lot of quality improvement programs through our chapter, we had 10 practices participate. And what we did was we made sure that physicians counseled families about guns. What was interesting was we had 0% counseling prior to the campaign, and throughout the QI program, we got up to 95% counseling on every well-child visit. When we asked families, 49% said that they learned new information from their physician. We also provided them with a gun box if they needed one, and so 62% decided to have the gun box when they stored their guns unsafe, and 81% agreed to use it consistently. We also gave them resources after the visit, and we did a media campaign for kids less than 5 years old, and we reached about 1 million viewers through social media and paid campaigns. We also have been putting together a suicide by firearm for teen campaign, and in this, we've enrolled 100 pediatric providers, and the goal is to screen for depression at every visit, to provide resources, and then recommend making firearms and medications unaccessible. We also enrolled 100 pediatric partners to also participate in this campaign. And we developed teen-specific materials, and it's been a media campaign statewide. Next slide. And so implications are, we had a great way to bring groups together. We learned a lot of very interesting things, such as gun owners didn't like us asking, is there a gun in the home? They preferred us to say barriers work, such as fencing around a pool, such as locking away medications. That is the reason we're having discussions, and assume that everybody has a firearm, since close to 40 to 50% in our state do have firearms. They also didn't like it when we talked to them and we were near a computer, because they felt that we were actually keeping data. But we rolled out a statewide campaign. We had pediatricians participate. We developed tools, and we offered families lock boxes. The other thing is now our governor is getting involved, and we're really hoping to get tax rebates for families if they buy lock boxes in the future. Below is Haley Southworth's information, and if you're interested, please feel free to contact her for more information. Thank you.
Thank you, Dr. Gittelman. It's impressive the way you brought these an assortment of groups together, and the reach of your program, and the lessons that you point out there, I think are applicable across many of our studies as we work with gun owners who are looking for safe storage. Okay, next up we have Dr. Sigel.
It's actually me.
Sorry, next up we have Michael Soto.
No worries. So my name is Michael Soto, and I did work on this project with Dr. Sigel, who will be presenting after me. And we did this at the Children's Hospital of Colorado. Next slide, please. So the American Medical Association have strongly recommended that pediatricians incorporate questions regarding the presence of firearms in their patient history taking and counsel parents about safe storage practices. But despite these recommendations, it remains common for physicians to screen patients for gun access in their home. And in the fall of 2015, there was a systematic change to the electronic medical record physical exam template that included this new question: are there any guns, firearms present in their home? And so by reviewing physical exam charts before and after this change, the data collected from these charts could be used to determine the effect of the EMR prompt on firearms screening in adolescent medicine clinic. So our research questions were, does including this prompt question about firearms in the household in the EMR template increase screening of youth access to firearms? This was our main question. And then we had additional questions. Is there a difference between the provider type, attending versus trainee, and their documentation of screening for the presence of firearm in the home? And did the presence of mental health and or violent behavior influence provider documentation of screening for firearm presence? So the data used for this project contained two groups at two different time points before this question was systematically added to the EMR physical template, and after this question was added. 110 chart reviews were reviewed for adolescents that visited the clinic for routine physical exam after this template change, and it was compared to a previous cohort of 140 adolescents. Next slide. So what we found was the proportion of provider documentation of screening for presence of the firearms in the patient's home increased significantly from 25% to 84.5% after the addition of this firearm question on the EMR physical exam template. And the relation between provider type and screening of firearms was significant. Trainees were more likely than attending physicians to screen patients for firearms in their home. And in addition, the presence of mental health and or violent behavior diagnosis did not influence provider documentation of screening for firearm presence. Next slide. So what we could see is that provider documentation after the addition of this question to the EMR physical exam template, providers were asking more adolescents for documentation screening for presence of firearm. And this also showed that providers will alter their behavior to the EMR template change. EMR notifications and prompts can help increase screening for gun access and possibly improve the prevention of firearm-related injuries. Thank you.
Great, thank you so much, Michael. One of the points of the many interesting things on that presentation is our trainees need to teach our attendings how to be comfortable asking these questions more. Is something that gives me pause there and I think is super relevant. All right, Dr. Sigel.
Yes, thank you very much. Can you guys hear me and see me? And Michael actually was a research assistant on the study that I'm going to be talking about, adolescent and parent perception of firearm availability and storage practices. Next slide. This is part of a larger study in that we looked at the effectiveness of means restriction counseling delivered by healthcare providers to families with firearms present. Little is known really though in both the research or clinical world about agreement and confidence in both parental report of both the presence of firearms as well as storage patterns compared to how adolescents may report. So we wanted to look at the agreement between those two factors and also to look at whether storage patterns impacted how youth perceived whether it was easy to obtain a gun in the home. So we recruited, ended up being a group of 51 youth parent dyads to participate in this study, and we gathered a lot of baseline information, including perception of the presence of guns, what both adolescent and parent reported in terms of storage patterns, and for youth, how easy they perceived it was to get a gun. Next slide. So I mentioned the number of dyads we had. You can see the demographic factors there. There was strong agreement in terms of whether there were any guns in the home, with 87% agreement, though interestingly, 13% of kids stated that they did not, or that there were no guns in the home when parents said there were. And then safe storage also, there was pretty close agreement, though 52% of parents and 54% of youth did report unsafe storage. Finally, for the youth who said, the 16% of youths who said that it would be easy to get one of the guns, all of those parents happen to have reported unsafe storage. And sort of the flip of that, the protective side of things, is that the 62% of youth who said they could not gain easy access to a gun, 2/3 of those parents reported safest storage. Next slide. So we do know from this smaller study that there's a strong agreement between youth and parent reporting of both presence of firearms as well as storage practices. However, there still was about a 20% disagreement. So for youth who thought, oh, my time is up, we also think that there's implications for clinicians in terms of counseling, recognizing that kids living in homes with unsafe storage are more easily reporting that they have access to those weapons. Sorry for closing up.
It's okay. Yeah. Thank you, Eric. The format, makes us to be quick. The good thing is we have so much good presentations this year. I look forward to a full day format in person next year where we can have longer conversations, but thank you for your time. So up next, we have abstract 5, Michaela Monsun. Welcome.
Hi, thank you. So for our study, we looked into firearm storage in families with teens that had been recently psychiatrically hospitalized. Next, please. So the American Academy of Pediatrics recommends for the safest overall method is complete removal of the firearm from the home, but as this isn't always realistic for all families, the second best option is to keep guns or firearms locked, unloaded, and ammunition kept separately. And in this descriptive study, we investigated how parents and adolescent inpatients were storing their firearms after the adolescent had been discharged. So data were collected as part of a larger pilot intervention study involving adolescents, N equals 80, majority were female, majority Caucasian, that were hospitalized due to suicide attempt and/or suicidal ideation. So during hospitalization, parents, majority mothers, received recommendations for firearm and other lethal mean restrictions as part of the broader intervention. And then we had follow-up assessments administered at 1 and 3 months. And during these follow-up assessments, parent measures included items related to firearm ownership and storage methods. Next, please. So a majority of the parents, 75 out of 80, completed the 1 month follow-up, and 23 of those reported owning a firearm. So all 23 firearm owners reported restricting access in some way. 22 of the 23 were self-reported on a Likert scale, taking the highest possible level of steps to limit access to firearms in their household. Only one family reported completely removing the firearm from the household, which we know is actually the highest level of steps that could be taken. Of the 22 owners that still had the firearm in their household, 100% reported at least one method of locking their firearm, and over half endorsed more than one firearm restriction method. 6 also self-disclosed that they store their ammunition separate from the firearm, though this may be underreported as we did not explicitly ask this question. And then all firearm methods remain the same at 3 month follow-up, with one additional family removing the firearm from their home. Next, please. So in the sample, all firearm owners did endorse at least one method. And then although it is not possible to determine if our study intervention directly impacted behavior because of a lack of baseline questions related to the firearm storage, and also similar recommendations may have been part of the standard care during their child's hospitalization. It is still encouraging to see that everyone did do some sort of method. And while the prevalence of firearms in the sample was similar to nationally representative sample of households with children, parents with these high-risk adolescents restricted firearms at a higher rate. And a limitation of this study includes not explicitly asking parents if they stored their firearms unloaded, separate from ammunition, and locked. Future studies may want to investigate this further. Thank you.
Thank you, Michaela. So that your presentation highlights for me, when we say safe storage, that's actually a whole spectrum of things. And as our field progresses, we will learn the methods and measurement that are needed to really understand when we're having differences in this, how to ask the questions better to one of our first presenters in terms of asking near a computer or not near a computer, and how we get valid answers in this is all part of building this field as we work towards having safer storage for firearms, is understanding the methods and measurement around it. Just for our junior trainees to think about, there's so much there just on the measures that we need to understand better as we start a field, really. Okay, Cindy, welcome.
Thank you. Good afternoon, everyone. I want to start by extending our thanks to you, Rebecca, and the FACTS Consortium for the opportunity to be one of the FACTS pilot projects. So thank you. And I also want to acknowledge the Marquette County Suicide Prevention Alliance and Sarah Derwin in particular, because this project was really born on based on their experiences implementing lethal means counseling in Michigan's Upper Peninsula. Next slide, please. So we know that in rural communities, the suicide rate and the rate of firearm use and suicides are higher than in urban areas. And we also know that residents of rural communities tend to have much higher rates of gun ownership, and that firearms have important and valued roles in community and family life. In this project, it was important to us to partner very intentionally with the community to learn from them about how to tailor a safe storage intervention that had universal applicability to rural families with children. And we're just completing our pilot study this week. We look forward to sharing that some more next time. Next slide, please. What I'd like to talk about today is our intervention development work and what we've learned from our focus groups. So you can see some information about our participants here. We held 6 focus groups and 6 key informant interviews. Our participants ranged from high school kids to older male members of a shooting sports club to a school administrator, a group of community moms, so a real range of stakeholders with lots of great information to share with us. We used a mixed methods approach. You can see some of our quantitative data here from our focus group participants. We also used a standard script of focus group questions. We really wanted to learn a few things from our community. What types of community values need to be reflected in a culturally tailored safe storage intervention for rural families? What should that safety message say? How should we deliver it? What are the barriers that we should know about? And who are the most credible messengers? You can see here, 1 is most credible, 8 is least credible. And you can see our participants had a very strong preference for hearing a safety message from folks who have a lot of specific knowledge about firearms, and really less of a preference for some of the folks that we tend to lean on to do this messaging, like healthcare providers, mental health professionals. Next slide, please. So I'm excited to show you a preview of how we applied our focus group data to the development of our safe storage intervention that's called Store Safely. You can see that some of what we learned from our focus group here with you. So they told us that reaching people online really helps with accessibility in a rural area. So that's what we did. We developed a video. You see a snapshot of that here, and our messengers are a family, dad, grandpa, and teens. And you can also see how we used some of the values of the community in terms of hunting and outdoors to visually tailor our intervention. Our time is up, so I'm excited to share some more about this in the future. Thank you.
Good morning.
I'm muted. There we are.
Okay, great.
Yep. Sorry, I had to unmute my video there. My tech glitch, the grace that I asked for. So thank you, Dr. Ewell-Foster. That was fabulous. I'm really looking forward to seeing the video. And I think a take-home point to share with this group who are all trying to get at this safe storage from different angles is to think about our messengers and it's probably a matter of messages in all of these realms are important. But also thinking about that it's not just one of these realms of messaging. Healthcare is important, but for example, then our other leaders in our community and other credible messengers are also really important as well. And figuring out what works in one community may be different than what works in another community. And really applaud you for the rigorous focus group work that your team has done so far. So with that, we're a little behind, but we're okay. Ferhana, I promise you will get your time. And so I welcome Ferhana Begum to talk to us next. Thank you.
Thank you. Good afternoon. My topic is about the development of safe firearm storage in rural Native communities, rural Native Alaskan communities. This region is disproportionately affected by suicide, and young people have the highest suicide rates in this country, majority of which are due to firearms. So our intervention is intended to target families rather than individual youth, as 75% of suicidal acts in this region occur in the home and 90% of homes have firearms. Next slide, please. While our team is still in the process of developing the intervention, we've gained a lot of information about factors and determinants that we need to consider through 3 focus groups where we're able to communicate with community members to gather information about beliefs, concerns, and barriers to safe storage. And we are in the process of completing a questionnaire to see how these factors vary across population, gender, and age. Next slide, please. We want to know how to create a culturally appropriate intervention for safe firearm storage in Northwest Alaska. So while creating the survey, we want to ensure that participants find it easy to understand, contextually relevant, and while taking into consideration any concerns they might have. So we worked with multiple community partners, and primarily Manilik Association, which is the local tribal health organization, but we've also reached out to residents and locals in the region. Next slide, please. So here we have a more detailed overview of the feedback we received from our survey. Our feedback ranged from minor wording format changes to really concerns about how the survey results will be used. Next slide, please. The feedback included concern that the survey will take away firearm and subsistence rights from the community. Much of this distrust is really due to historical discrimination, which is why having local partners whose first priority is of the community is so important. We were also asked to offer firearm safety and mental health resources for people who might find the survey possibly distressing. Questions about when youth start using firearms were changed to consider maturity as the more important factor than age. There were also possible gender differences in firearm use that we need to consider. Finally, many of our partners believe that the survey should be used as an educational tool for people to understand what safe storage is, what it looks like, and how it aligns with cultural values despite it being a difficult topic. Next slide, please. So adapting to the survey to be more culturally responsive encouraged us to be more reciprocal and intentional about the impact of the survey and its contribution to intervention development. So while the survey got most of the information we believed was important, we missed how factors like age and firearm training are so dependent on context. Community-based research made us consider what we were asking from people and to ensure that we gave back. The process allowed us to understand the cultural and local context, be reciprocal in its process, and ensure transparency about a subject like firearms that's often politically charged. Thank you.
Okay, there we go. Yeah, thank you, Ferhana, for that great presentation. Again, a reminder that the context in which some messaging is developed will not be universally, will not work everywhere, and culturally tailored for local populations with firearm work, as with most public health work, will continue to be incredibly important. Okay, and with that, I welcome Christina Johnson to talk to us about the adoption of Safety Check.
Hi, can you hear me?
Yes.
Awesome. Okay, so yes, I'll be talking about our adaptation of Safety Check, which is an evidence-based program that has been shown to increase parent-reported safe storage of firearms. Next slide, please. So we use the Adapt It framework, which is a framework used to iteratively adapt interventions to do this adaptation. And for reference, the original Safety Check program involved screening for firearms in the home, counseling by pediatricians with parents, and then providing a cable lock. So you'll see that we did numerous iterations of intervening stakeholders and adapting the program. And I'll talk a little bit more about this in detail on the next slide. Next slide, please. Okay, so on the left here, you'll see we've got the adaptations that we presented to our second round of stakeholders based on our first round of stakeholder feedback. And you'll see the little images on the left describe the feedback that we got from the second round of stakeholders. So we got positive feedback on those first three, removing screening for guns in the home, emphasizing the shared goal of keeping kids safe, and providing resources around safe storage. Next slide. We got mixed feedback around the program name. So we presented it to, we presented a bunch of different name and logo options to parents on Amazon Mechanical Turk, and this was our top choice. And I'll speak a little bit to the follow-up and take-home reminder on the next slide. Next slide. Finally, we took all of these adaptations and the name and logo, and we presented them to more parents on Amazon Mechanical Turk. As you'll see, we got largely positive results, although firearm owners did like the program or found it a little bit less acceptable than non-owners. Next slide. So overall, the program was found to be acceptable and appropriate, although we found that parent autonomy and privacy is still important to think about as we continue adapting. The follow-up and take-home reminders are really the thing we're going to continue adapting more, because there was some concern about them being potentially seen as intrusive. And we'll continue doing pilot testing of the program ahead of a Type 3 effectiveness implementation trial. And the ultimate goal of all of this is to decrease unintentional injury and suicide by firearm in youth.
Great, thank you, Christina, and to the whole team for that work. So we do have some time for questions, and I have some questions queued up here, and people can feel free to continue to submit other questions in the chat as well. So if our panelists, abstracts want to put your videos back on, please, so that everyone can be seen. I will feel less lonely up here on the screen. So Rocco, I think I have a question to start with for you. Your results show that parents and caregivers feel it's okay for health professionals to talk about firearm safety when there are children or teens in the home. What does this look like in practice, and how does this reduce risk?
I honestly feel like, as many other panelists here have expressed, there isn't a lot of evidence about what the best approach is, but all of this great work is starting to dive into those questions in more detail. But I think our results showed particularly that, and I didn't say this in detail, but that if a parent is aware or a caregiver is aware of the risk, the increased risk that children have for firearm injury when there are guns in the home, making it clinically relevant to have a conversation about the importance of safe storage is widely acceptable, and that includes among gun owners themselves. And so I actually would like to highlight some of the other conclusions that panelists have made, like knowing about firearms, knowing what recommendations to make, and knowing when to make referrals to experts and other people, using the right language. There are a lot of considerations that are likely very important, and evidence is beginning to show are very important in order to effectively engage with pediatric caregivers of pediatric patients.
Great, thank you, Rocco. Michael Gittelman, I have a question for you, I know some of you are answering the questions as they've come up as well, and I appreciate that. So there's some question if you can explain the goals of your program and what outcomes you have seen and expect to see from it.
Well, the goals were multifaceted. One was to see if we can develop a quality improvement program so that pediatricians would be able to counsel families about a safe storage of guns. And we were able to have pediatricians learn, be able to put it into practice, and 95% of the time be able to counsel and provide not only education, but also gun boxes when appropriate. So we felt that that part of the program was pretty secure, and we're actually expanding it to other pediatric practices throughout our state. Also, the media campaign, having a message that everyone could rally around, we thought was also pretty new. Similar to like Click It and Ticket, it was Store It Safe, and everybody was around it, and it was all throughout the state. There were billboards now up in the state, and we have other groups that are buying into it and using that messaging. And then the last one is really be able to get teens now involved and discuss teens and suicide and get adolescent medicine doctors, behavioral health officials to not only screen for depression, which is something that has not been done regularly, but then when screening for depression, a lot of groups are screening but not providing resources. And we're providing resources such as gun boxes and education about Store It Safe. So I think that there were a lot of really cool outcomes that we got just from a very short program.
Yeah, thank you for that. I have questions I'm going to give. It's the same question first to Ferhana and then to Christina. You both did stakeholder feedback and focus groups on your intervention, which is an important part of the stage of intervention development. And so if first Ferhana, what feedback did you get that surprised you? What was the most surprising feedback that you weren't expecting going into this? And then the same thing for you, Christina.
I think it wasn't so much that I had surprising feedback, as this was really the first time I worked with a rural population. More so some things that we've missed that we were like, of course we should add this. Why didn't we think of it sooner? So things like age, maturity, and gender in terms of who was handling firearms, who was in charge of firearms. So really not so much surprising, but things that made sense, but we didn't think of it.
Mm-hmm. Yep. Christina?
Yeah, I think for us, the thing, or at least for me, the thing that was most surprising, although also similarly made sense upon further reflection, was the feedback around the follow-up reminder, which I just answered a question about in the Q&A. The reason we were thinking we would include that is because we thought, this would just be helpful for parents. They're all busy. This will help them remember to use the gun lock. But we got some pushback around, that'll feel intrusive. That'll feel like you're kind of watching me and monitoring what I'm doing with my guns in my home, and that's not really your business. And so having to think more about that, how can we do something that's helpful, but still acceptable? So I think that was the thing that I found most interesting and surprising.
Yeah, more work to be done. There's a question that came up that I'll toss out to any of you if I can. I have to find it here in my chat. Here we go. The question was asked, has anyone considered research on the balance between safe storage and rapid access? And I don't know, Michael Gittelman, if this came up in your kind of work at all. Products like fast action safes, or has this come up in any of your work at all? It's obviously a balance, right? I mean, we want safe storage, but many of our families also want rapid access. And how do we help achieve some of that? And how has that come up in your work at all?
So it was really interesting when we worked with the NRA and concealed carry and military, they all had the same message to us, which is if a gun is not on my possession, that gun needs to be locked because it should not be accessible by anyone else but themselves. And so they were all very clear that locking up your firearm is something that needs to be done. And so they all had different forms of access. What they all agreed upon was the biometric safes are the best because they're very rapid access. But they said that is not the problem. The problem is if you are concerned, have the gun on you at all times. If you do not have the gun, it should be locked away. So there was a consistent message by them, and they weren't worried as much about rapid access because they felt that they could get to the gun quickly. This was not studied. This is just report from our meeting that we all can, when we all discuss this.
Yeah, it's great threads to bring out. I mean, there's been a lot of conversation, positive and negative, I think, by many of our focus groups in terms of biometric access. And I've heard a wide variety of responses to that among the gun users that we've been working with. And that may be different depending on the context that we're talking to people in. And this group here represents a broad variety of contexts across urban and rural America, and sub-communities within that. So we are out of time, but I'm really excited. It was great to have 9 or more abstracts really focusing on a similar topic, coming at it from different angles, and seeing how together we can advance this topic of safe storage to prevent gun deaths across children and teens. So thank you all very much.